Good morning and welcome to the American Academy of Ophthalmology for 2025, our annual meeting. So this year marks the 40th anniversary of EyeCare America, which was launched in 1985 under Dr. Bruce Spivey. Now, EyeCare America was established as the first independent public eye health program with national reach, and it had the goal of connecting uninsured or underinsured seniors with volunteer ophthalmologists across the country. Now, to date, EyeCare America has connected approximately 10,000 volunteer physicians with more than 150,000 patients in need of eye care. So now, back in the mid-1980s, the operation was actually run through a phone bank. And in the very first year, EyeCare America fielded nearly 200,000 calls from financially disadvantaged seniors seeking eye care. And as it grew over the years, it of course also had to evolve. So a glaucoma eye care program was added for eligible seniors in 2002, and then the arrival of the internet allowed us to finally replace the phone bank with an online referral service. But EyeCare America remained exclusively a program for needy seniors without capacity to extend eye care to patients under the age of 65. And of course, the problem is that there are millions across America under the age of 65 who are uninsured or underinsured, but who do need access to health care, including eye care. Now, for many of these individuals, as pointed out by the Academy's Task Force for Disparities in Eye Care, it's a nationwide network of community health centers that fills this gap. Now, so how large is this network? So there's a subset of community health centers that meet criteria for service to under and uninsured patients that allows them to receive direct federal funding. So there are nearly 1,400 of these so-called FQHCs operating at over 14,000 locations around the country. So what's the profile of the millions of patients who are served by our FQHCs? So in 2024, 2/3 of these patients were at or below 100% of the federal poverty guideline. 90% of these patients were below 200%. 20% of these patients were completely uninsured. Nearly half of these patients were going to rely on Medicaid or on CHIP. Interestingly, this population continues to grow. So between 2000 and 2024, the number of people getting care at FQHCs has more than tripled. It was 10 million back in 2000. It's more than 30 million people today. Now, this is the problem. Only about 1/3 of these health centers provide any vision services on site. And if you think about it, it's estimated that within the FQHCs, about 15% of all patients have diabetes, which is of course going to include a lot of younger patients, all of whom need eye care, but all of these younger individuals would fall into our EyeCare America service gap. So this is precisely what has prompted us to rethink and to restructure the EyeCare America program, specifically to try to meet the needs that have been exposed by our underserved FQHCs. So in April of this year, we expanded access to include all patients under the age of 18 years of age or older, and regardless of insurance, so long as they had not seen an ophthalmologist within the last 3 years, nor had they seen an EyeCare America volunteer in the past. We recognize that part of the challenge that we face as all of us try to meet the eye care needs of the entire population, including the underserved, is one of workforce and of bandwidth. So from the very outset, we've looked for opportunities to try to engage innovative tools from AI in the clinic. So we've established partnerships with industry to explore the logistics, the effectiveness, and the outcomes of AI screening for diabetic retinopathy, coordinated with primary care visits. So with these systems, patients with findings can then be referred to an EyeCare America volunteer for further care. So this is the approach that was implemented in a program that was initiated by the Academy's Task Force on Ophthalmology and Community Health Centers last year, where the Academy partnered with industry partners and with local physician leader, Dr. Paula Coe from the Delaware Academy of Ophthalmology, along with Jeff Henderer, who's the ophthalmology chair at Temple University. So we equipped an FQHC in Delaware, the Henrietta Johnson Medical Center, with an AI-powered tool for diabetic retinopathy screening. And so patients there who were there for a primary care visit, who were screened and found to have retinopathy, were then connected for further management with a local EyeCare America volunteer. So this pilot was really instructive. More than 500 patients were screened over 18 months. More than a third of the gradable images had referable diabetic retinopathy. About 60% of these actually had vision-threatening findings. So if this is representative of the 2/3 of all FQHCs out there without EyeCare services, these numbers suggest that there really is a tremendous need for strategies to identify these patients at risk and to direct them to care. So this is why we're so grateful to the Knights Templar Eye Foundation for their support as we move towards expanding the reach of EyeCare America screening and referral programs. So this year, the Knights Templar Foundation granted the Foundation of the American Academy of Ophthalmology $1.5 million to support this initiative, thereby facilitating the largest expansion of EyeCare America program since its inception. This funding will help to provide vital screening equipment and to support operations as we build the program with additional pilots, and those are going to allow us to develop experience while actually helping patients. This is the experience, the data, the detail that is going to inform and support our advocacy efforts as we make the case locally and in Washington, D.C. for funding and for policy that better supports the needs of our patients across the country and the doctors and the practitioners who care for them. But, of course, both now and for the future, this relies on you, ophthalmologists around the country, supporting our advocacy efforts, and wherever and whenever you can, supporting our volunteer efforts. And you can help today by joining EyeCare America as a volunteer, and of course, a helpful QR code. As we chart out the steps for the program next, as we try to expand, we'll be very happy to hear from retina specialists, especially in the North Carolina Outer Banks or in the Palm Beach region right here in Florida. EyeCare America has been an invaluable resource for patients in need for over 40 years, and with all of your help, we know that there's so much more that we're going to be able to do. Thank you very much indeed.